Good afternoon.
Good afternoon. We did it right.
We did.
Although it's still spinning. I don't know if it's
thing.
really live. I think it is.
I think we are. Yeah.
Okay. So yeah, good afternoon, everyone. So, what? Did I say it weird?
A little, but it's okay.
That's okay. Like a game show host.
Yeah.
So we had a whole lot of fun on
Doesn't
Thursday.
that feel like so long ago?
Yeah,
I feel like it was a really long time ago.
it was.
I was really sore on Friday. And every time...
And why? Why, Crystal?
Well, because I was doing, punches and high kicks. They couldn't see my high kick, but I was doing it.
Oh.
And, So then I was really sore on Friday.
Yeah, we had a lot of fun with the trunk or treat event.
Mm-hmm.
We rocked it out.
Literally. We did.
Literally, yes. Rock and roll, man.
For life.
Crystal scared the small children. That was great.
It made me really sad.
Yeah.
Because no one else, Lindsay interacted with the children, but for the most part, I was like, oh, hi, kids, look at you. And they were all scared of me.
Yeah, and at least Lindsay had the least scary, I think, makeup because she was Star Child. So she just had the star and white makeup. So that I don't think was as scary.
No.
Plus, Lindsay is Lindsay.
So sweet.
And she's so sweet. But, yeah.
Except she was throwing candy at the kids. So if any of your kids got hit with candy, we're really sorry.
I think
about
she only did that a couple of times, though.
After I yelled at her, I told her she couldn't throw candy at the kids.
Her aim is not good enough. Your aim is not good enough, Lindsay. Oh, man. But she was so funny. She was asking all the kids about their costumes and stuff. So she was into it.
So Anna, we said hello. And all that. She's telling Elsa. So,
Yeah.
That was fun.
Yeah, it was cute. It was really cute. And we had so much candy. I still need to take back the extra.
Well, yeah, the last two cars. Well, did I tell you I actually felt really, really bad because I dumped the rest of the bucket into one person's car because I thought that was the last car. Well, apparently there was another car behind them that wasn't actually leaving because we thought that it was everyone packing up.
We thought that was somebody that packed up and left.
Yeah, no, it wasn't. And so then I felt really, really bad.
You could have just opened one more bag.
I could have. I'm thinking about it
just
now.
give them a bag. I should be like,
Here you go.
bonus gift. Oh,
Sorry about that.
That's all right.
So I felt really bad. But I'm sure that they still made out
because they kept saying that that's the last one. That's the last one. But it wasn't the last one.
There was still
they kept adding more on. Yeah. So if that was you, we are very sorry. We didn't mean to.
I felt really bad about it. So then I
you should have given them your wig or something.
Well, then I kind of pretended like it didn't happen.
Mm-hmm.
But it did, and I'm sorry. So.
Oh, no.
My child was also a little scared of me as well. He came through
that's fair.
The trunk or treat. And every time I would get a little bit closer, he would lean back. And then the next morning over the baby monitor, I was like, buddy, it's time to wake up. Go to get ready for school. And he was like, Mommy, does your face still look like that? No, it doesn't.
Does your face still look like
Yeah. But then he wanted to know why.
Yeah.
But yeah. Mm-hmm. You want to show him your award?
Sure. Yeah. So we did win an award. So in case, for those of you who don't know, we did dress up as Kiss because it was a music theme.
And we looked awesome.
And we looked amazing. And we did win an award. We won second place, best in show, but we called shenanigans.
And in our hearts, we got first place.
Because, I don't know if you've ever had like a full face of like costume makeup with wind going
and wigs
and 80s rock star wigs happening,
which were not good quality. It's not
it's not like we got fancy wigs.
No. So
that was kind of miserable. Once it stopped being so windy, it wasn't so bad. But
yeah.
Like, the wigs were sticking in the makeup, and it was not super fun.
Yeah. Amy was like having a panic attack because it was like mixing all of her makeup, and she was very particular about it.
We worked really hard on our makeup. and all our costumes and stuff. So yeah, plus we were rocking hardcore.
We were the whole time.
The whole time.
That's why I was so
We were
sore.
like putting on like a whole little concert situation. Just like this. Doing some lunges and some high kicks.
They can't see that, but that's okay. This isn't the song I would have picked for today,
I know it's not.
but that's okay.
I don't care. I liked that it was Dr. Love.
I know that you don't care, because you don't care about me.
We can play your song next week. That's fine. So in other news, we have are you playing with the comments?
Yeah.
Okay. So we have another event coming up in November. It is November 20th, which is a Friday. From 1, I keep kicking it.
Stop kicking it.
Can't help it. Friday, November 20th, from 1 p.m. to 3 p.m. We gonna have Santa! Woo! Santa! I know him. I love Christmas. So I'm excited. Like, November 1st. Sorry, Amy. Halloween's gone. We're putting up Christmas. Because I need to be ready for Santa.
Yeah.
So, yeah. And for those of you who don't know, I do have an obsession with Christmas. And too many Christmas decorations. So it's going to take me some time.
Yeah.
To get
and
everything
she's very
ready.
particular about her decorations. Any
decorations, but yeah, especially it gets worse when it's Christmas decorations. So that's a thing. So that'll start happening.
I need you to come to my house this year and decorate my Christmas tree. I bought a ton of Christmas tree decorations last year so that I would have a really pretty tree, because I don't normally, I'm like, man, it's fine. You just throw the ornaments on. I don't want any part of it. But last year I went out and I spent some money.
Yeah.
And I got some really cute decorations. I need you to come do my tree. I'm putting you on the spot, so now everyone knows that you're supposed to come to my house.
I mean, okay. Once my house is done, that's
Okay.
fine. That's fine. So yeah, so apologies in advance to those who are offended by Christmas before Thanksgiving. It's just how it worked. I mean, Santa was only available on certain days.
And she booked him last year.
He's very popular. Yeah, I booked, like, when we did the event last year, that day, I rebooked for this year. So this was like the best we could do. But I also didn't want to wait till necessarily like December, because then doing it earlier, then you could have the pictures for like Christmas cards and stuff. So
plus, Christmas just gets busy for everyone anyway.
It does.
So it's easier to do it when people aren't quite as busy.
Yeah. So apologies in advance for those that are offended.
She's not actually sorry.
Too bad. It's just an excuse. It's an excuse to put this stuff up. So we'll be doing that. So what we're doing is, ideally we're going to have people calling to schedule a time slot to come in. We're doing like 10-minute time slots for everybody, so that we're doing some social distancing and that. But if you can't plan ahead that far, that's totally fine. If you want to just show up, that's cool. We'll squeeze you in between people. It'll be fine.
Please,
we'll figure it out.
One thing to say with that, please keep your animals in the car when you get here.
Yeah.
Because we do have some animals that want to come up for pictures, but they don't like other animals.
Sure.
So try not to, get your animals out of the car before we kind of usher you in, because we want to make sure that the people who do want to come get the pictures that maybe don't feel like they can because their animals maybe aren't very great around other animals, we want them to have a chance to come get pictures with Santa too.
Yeah.
So please, when you get here, either give us a call or come up to the window, whatever, let us know that you're here before bringing your animal out.
Yeah. I figured one of us will be out, like, watching for cars and maybe just check in on a clipboard, and we'll have like a whole little pathway so that animals aren't necessarily interacting and keeping everybody separate. So, because our clinic kind of does a big circle anyway, so I think if we can bring people in through the front doors and then around through the treatment area and then in where the pictures are going to be, and if we have to have holding areas in our exam rooms, that's totally fine. We can make that work. So so we'll have a whole plan for
so
the
if your
day
animals
of.
don't get along, that's okay. Just
Yeah.
let us know.
Don't be deterred.
In advance. Yeah. We'll we will work really hard to make sure that you can still get your pictures.
Exactly.
With Santa.
Because you gotta love pictures with Santa.
Right.
And it could be dogs, cats, I don't think he cares. People.
Yeah.
Children, adults. It doesn't matter.
Yeah.
Whatever.
You want your picture with Santa? Come on up.
Yeah, we all had our picture taken with Santa.
8 people watch. I think that's the most we've had at one time.
You're
8
such
people.
a nerd. But yes, so if you have not seen Santa Frank before, he's amazing, amazing. And I know they said that all their dates for the rest of the year are already booked up. So too late. But if you need a Santa next year, now would be the time to get a hold of them and get on the schedule because
he's very, very nice.
I think we actually did book 2 years out. I think when they were in last year, I think I did 2 years.
Probably. That sounds about right. I'm surprised you didn't do just like the rest.
For the next 10 years. Let's just have a standing date and it's fine.
Yeah.
Forever. Forever and ever. It's okay. I love Christmas, man.
I know that
I
you
just do. I just do.
It's like your favorite thing.
So that'll be fun. So look for events. It's already posted on Facebook. It's pinned to the top of our page. So if you are looking for details on that, like I said, just give us a call. We'll schedule you a time slot. And we'll.
We've had a few people call already.
Yeah, we have already had people call. So
like 10 minutes.
Get it now. And unfortunately, there will reach a time. I mean, depending on how we weren't that busy last year, but he does have to leave by 3:00. So if you get here at like 2:55, I can't promise that you're going to get a picture with Santa.
Yeah.
So get here early if you're going to be a walk-in. Get here at 1 if you can. So yeah, that's.
Are we going to have like hot chocolate and stuff like we did last year?
I don't know that we're going to have food
because of the.
Yeah, like I might see if I can find like some little individually wrapped like cookies or something like that. Maybe we'll do something like that.
That would be nice.
I don't know. I haven't figured out what kind of refreshments we can do safely.
Hot chocolate was so good last year.
I put in a whole lot of chocolate in my hot chocolate.
It was delicious though.
It was good. But yeah, we'll figure something out. I mean, maybe I can at least do like some little milks and cookies or something like that. I don't know. We'll see.
Yeah.
We'll figure it out. But there might be some little snacks. So, all right. So then the other thing that we were going to talk about today, which is not as fun.
No.
A little bit of a downer. But too, as we start looking at coming up on the holidays and the end of the year, this is unfortunately something that we see more commonly. We see a lot more animals that are needing to be euthanized. And I think there's many different reasons for that. I think some of it is people were trying to make it till the next holiday and maybe they just didn't make it. Or, people come over and they're like, dude, the dog's looking bad, and things like that. Kids come home from college, that sort of thing. So I think there's a lot of different reasons that this happens, but we commonly see kind of winter time over the holidays, we see a lot more euthanasias. And so a common question that we get is, how do you know when it's time? Which is fair, because it's a very complicated issue, for sure. So what do you say to people, Crystal, typically?
I mean, it is a sticky situation because you know your animals better than we do. And the hard part is when they come in here, their adrenaline is running and they get all excited. Maybe they're not limping like they were at home. Maybe they're because
they look a lot more bright and alert and happy and
and a lot of times owners don't understand. They're like, oh, well, they're doing better now. And then they're not. They're just excited and they're happy to be here and their adrenaline is up because a lot of times they don't go places from the day to day. So it is difficult. But if you see that they're deteriorating at home, maybe they don't want to get up and go to the bathroom as often, not eating, not drinking, especially those dogs that love food or love to drink, a whole bowl of water and then vomit everywhere. But you know your animal better than we do. So that's something that I will tell people. Plus, there's this lovely, quality of life questionnaire.
Yeah, and there's a few different ones available online. I printed out a couple of them. This one, it's the, how many ages are there? 5. Scale. And so basically it goes through a few different categories and then has you grade it on a scale of 0 to 10. And then there's another one. It's very similar. It's a lot of the same. This is going to be too small. It's a lot of the same line items, and it just has you say, strongly agree, strongly disagree, whatever. And neither of these, I think, will be like, if you score this or less, it's time. But this one does say a total of greater than 35 points means that they probably have a decent quality of life still. So this isn't meant to like be a cosmopolitan quiz where it's going to tell you a specific thing, like, oh, today's the time, or nope, not yet, give it a month. It's not going to be like that. But I think it creates a good tracking that you can do over the course of time and see where that trend is going and how quickly. It can also just open up that discussion for family members at home, where, like, well, what do you think? Because it's going through things like hygiene and happiness and mobility. You guys can kind of talk about that together and see, well, what are you seeing? Do you think Fluffy's happy? How happy do you think that he is? Is he still able to do the things that he used to love to do? Or, are we just being a couch potato and he used to love to run and play fetch in the yard? Well, then that's something to discuss. And I think that's important too. A lot of people will say, well, when they stop eating, that's when it's time. And while a lot of the times that is true, but that is not the only time that we euthanize. We don't wait for them to stop eating necessarily.
We don't want them to be miserable and uncomfortable and painful for the last however long of their life.
So like my one lab that I had, Hunger, he was eating great. He was doing amazing. His hydration was also fantastic. Those would have been 10s. But mobility was like a 1, because he couldn't take 2 steps without falling over. And so he wasn't able to hop up on the couch or the bed. And yeah, we can help him do those things, but he couldn't position to urinate and defecate. And that, he'd fall over and he'd get in it and be a mess. And, so those sorts of things. Okay, great. Yeah, he was still eating, but still I didn't feel like his quality of life was good just because he had really bad arthritis, hip dysplasia. So, those are just things that every animal is different too. We need to look at, what used to be what they did all the time. If you have an animal that is normally a couch potato, well, then being a couch potato at the age of 15 is not a loss of quality of life. That's what they always did. That's what they always did. That's what they always enjoyed. If you have a lot of like the little tiny dogs, they don't have great appetites. They're picky eaters. So like being a picky eater when you're 20 years old, okay, that's the same as it's always been. So that's not a change. And so then you start looking at other criteria for that. Mm-hmm. So yes, like I said, these are nice. They're certainly not anything that's going to give you like directions. It's not going to tell you to do something, but it's helpful to just consider all of those areas of your pet's life, I think.
Yeah, absolutely. Mm-hmm. And we can talk to because we've had in the past where one family member says it's time, like this needs to happen. Yeah. And then you have other family members who are kind of in denial about it. Mm-hmm. And, you're more than welcome to come in, do a consultation. Mm-hmm. We can talk about the quality of life with them. Mm-hmm. We can discuss, what one of them is seeing versus the other one, or just kind of walk through that. Exactly. But sometimes people don't see those things because they don't either no one is talking to them about it. Yeah. Or they don't understand that, your dog is panting and not eating because it hurts or whatever. Mm-hmm. So we can definitely discuss things like that with the other family member if that's something that they're open to. Yeah,
because I've had people in the past that are like, well, you need to tell my husband that it's time. That's not really, I don't necessarily feel like that's appropriate. There are times, where I'll see something and I'm like, that's not okay. Like you don't have a choice at this point, but that's rare. That is very, very rare. Yeah. And so most of the time, like, I'm not going to sit here and try to convince your significant other that it's time just because you think it's time. And while I might agree with you, I may try to highlight some things and ask some questions in that and discuss if there's any options of other things that we can do, any hospice care, things like that. But yeah, it's not our jobs to convince someone that it's time.
Right. I think
That's a big thing.
The worst for me is when they come in and they're still happy and they are getting around okay, but maybe they've got something that we can't fix. It's not gonna get better, and that's definitely difficult. It's all difficult.
It is,
but it's harder when they're still mentally there or their body just isn't.
Yeah.
So,
and I've had those discussions with people before too, and this is where it becomes a very personal thing. I've had discussions with people before where it's like, well, right now they're not so bad. Maybe they still have an okay quality of life. But yeah, we've diagnosed something that we know is not fixable. It's only going to get worse. And for some people, they're like, no, I don't even want him to suffer even for a moment. And I would rather just do it now. I think that's perfectly reasonable. And so that's a conversation that I'll typically have with people too, especially when we have chronic illness diagnoses where there's not anything to fix. I can't fix debilitating arthritis. I could do pain meds, we can give pain meds, we can do supportive care type things. I can't fix that though. And so that's, a conversation that we can have about, well, what are our options as far as treatment goes? At what point do we think it's time? Is it time now? Is it something that we're going to wait till a certain point, till something happens specifically, until he can't chase the ball anymore, then we're fine. Okay, that's a very personal decision because again, I can't fix it. I can't make it better. It's only going to get worse. So, these are very honest conversations. And I don't know that I've ever judged anyone either way that they choose. Either way. Because it's hard. That's a really hard one. And there are, like I said, there are certain times where I'm like, no, like you have two options right now and that's it. I saw a dog, unfortunately not here, at a different clinic this weekend where I had to tell the owners, I was like, I'm sorry because this is really, really fast, but your dog has a tumor that's bleeding in his abdomen. So you have two options right now. You either put him down or he needs surgery today. This is not something that we can sleep on and think about and, debate back and forth. It's unfortunate, but he's either going to die on his own because he's going to bleed out to his abdomen or we need to put him down. So.
And that leads into something else. A lot of people will say, I couldn't do your job. I don't know how you guys do it. And it is hard, especially the first, I'm not saying it's not hard now.
Right. It's not that it's gotten easier.
Right. But the first couple years it killed a little part of me. But you have to look at it in a different way. And sometimes in those kinds of situations, it's the nicest thing that we can do for them because, like Dr. Hogan said, there's two options. He is going to get surgery, or if we don't do anything, he is going to die anyway.
Yeah, and he's just going to suffer.
It's going to be miserable.
Yeah, which is not okay.
Yeah, I mean, most of the time, dogs, unfortunately, don't just go to sleep and not wake up. Right. There's usually something going on with them that we can help them and make it easier. For everyone.
Yeah.
So it is very unfortunate and it's not something that we enjoy doing, but it's something that we feel we're still helping. So
yeah, because our job is to relieve suffering. And so whatever that means, whether that's, treating an infection or, putting something down, it's all relieving suffering. And so that's how I see it personally. And obviously we don't do euthanasia just because
it's not convenient.
Yeah, we don't do convenience euthanasia.
We will tell people no.
Yep, I've had I think only like one or two where I have told somebody no before. But those were very specific cases. That's way outside the ordinary.
Yeah.
Those were things that were treatable conditions in a younger animal that had a good prognosis. This was something that it's not like they're dying.
Skin issue.
Well, there was the one.
Skin.
Yeah, one was a skin issue, and they hadn't really done a whole lot. There was another one that was a dog that was having seizures, and a lot of the complaints the owner had were due to side effects of his medication. And I said, well, we can just switch his medication. That's fine. She didn't want to do that. And I said, well, I'm not euthanizing this dog. So we took him. She signed him over. And he has a fabulous home now, so that's fine.
He does.
He won.
It took me a minute. I was wondering.
You're like, who are you talking about?
Right.
Yeah.
Yeah, I got it.
Yeah, our little friend. He bounced around to some of our homes for a
little He did. He went to my house
for fostering. Nights,
yeah. My husband came home and he's like, "Oh, hey there, buddy. Who's your friend?" And I'm like, "Oh, he's living with us now." Just kidding.
Just jokes. It's temporary.
Yeah.
But yeah, like I said, those are very rare instances. But yeah, we don't just put things down. This isn't McDonald's. You don't just get to come in and order things as you want. Well, I mean, just yeah.
That's a weird reference.
Why?
What do you go to McDonald's and
you just order what and they give it to you? Order what you want. Okay, Burger King.
What you want?
Have it your way. That's not how it works.
Are you not going to do it on the live TV? What you want?
I want some fries. Oh God. But yeah, so we are allowed to decline that. Mm-hmm. That is our prerogative, and that's a thing. And like I said, not something common.
No.
But yeah, it's typically something we have a conversation with the owner about and see if there are other options and things first.
Yeah.
So yeah. What else? What am I forgetting? Anything?
Do we want to explain how we do things here for someone that
we certainly can. Yeah, for people that don't know, and we do usually
we explain everything beforehand.
Go over this beforehand.
Yeah, and if you have questions, if you're thinking about anything, let us know.
Mm-hmm.
We're happy to answer any of those questions. It's not like you're in and out with nothing answered.
Right.
Yeah.
So what we do, so we have this that is actually where we are right now.
Gabby.
Yes, she knew who it was. Boogie Vince. So this room where we do our videos is actually our comfort room. Mm-hmm. So this is where we do the majority of our euthanasias. So there's this lovely little couch. It's very comfy. There's a rug. It's really big. There's a couple extra seats in here. So it allows people a lot of flexibility as far as how many people.
Entrance and exit.
Separate entrance and exit.
You don't have to come in the front door.
Yeah. You don't have to worry about going back out through the lobby afterwards because that's horrible. So people can sit on the floor. The animals can be on the couch. They can be in your arm. We don't care. It doesn't matter. This is your time. This is your room. You do what you want. So what we'll do when someone, ideally we have an appointment made, but that's not always the case. I've certainly had people where they call up and they're just like, I'm coming right now. I'm like, okay.
We don't have a choice.
Okay.
We have to. Yeah.
All right. Yeah. And, unfortunately, if there's other appointments that are here or scheduled, they wait. We would do it for them too. That's, just how we do things here is that you get to jump at the front of the line. And I'm sorry if somebody doesn't understand that or appreciate that. Sorry about you. Maybe we're not the clinic for you. So we'll figure it out. And so, you come in, we have a separate room. It's a little cozier than the exam room instead of being like on a cold stainless steel table and all that.
It's a little more.
It's just nicer. Home. It's more homey.
Yeah.
And so what we'll do, and people can stay through the entire procedure, half of it, none of it, whatever they're comfortable with is fine. And we typically try to check in with them throughout the process and figure out, what their preference is. And some people will change their minds halfway through. Mm-hmm. Some people say, oh, I can't stay for the whole thing. And then they decide halfway through, oh no, I'm going to stay. And that's totally fine too.
And you may have some family members that want to stay through all of it. Some just want to stay, for the first part. And that's That's totally fine.
Yep.
We cater to your needs and your family's needs as well. If you have small children, you can bring them.
Yeah, that's
if
on
you
a
don't-
case-by-case basis. I mean, you know your child way more than we do.
But I'm saying, like, in general, if you don't have somewhere for your kids to stay, you can bring them. One of the staff members, as long as you guys are okay with it, can definitely keep an eye on them. I've done that a couple times.
Yeah.
You know, because not everyone has a great support system that they can drop their kids off and stay for a little while. So feel free to bring them, and someone generally is able to stay with them.
Yeah.
So.
Yeah. And so what we do is we'll typically place an IV catheter. It's usually in a front leg. Sometimes it's in a back leg. It just depends on your pet and, you know, what their veins are looking like and temperament and all of that. We don't usually have to give them anything before we do that. They're usually pretty good with it. Although occasionally I've had where one was maybe like super nervous or a little aggressive
Or painful.
and we'll give a little light sedative first, and just give that 5-10 minutes or so, let that kind of just take the edge off. Then we place the IV catheter. But we would tell you if we're going to give them something, we will let you know. It's not going to, because I've had people before where we go place the catheter and we bring them in and they're like, "Did you give it to them?" I'm like, "No, man, not yet. I wouldn't just do that and not tell you." So we'll place the IV catheter, and sometimes the owner's present, sometimes they're not. Again, depends on case-by-case basis. But after that, they can stay with you the whole time if you want them to. So after that, that's the last needle poke that they need. And so that's why we do that, is so that there's only one poke. So I do 2 injections. The first one is an anesthetic. It's the same thing that we use for surgery, where it works very quickly, usually less than 10 seconds, most of the time for sure less than a minute. They just kind of relax and go to sleep. And we check reflexes and make sure that they're not conscious and all that. And like I said, it's very quick. That's very, very peaceful. Because they just kind of melt and go to sleep. And then I check reflexes around the eyes to see if they're going to blink, and if they don't blink, that reflex is gone, which means that they're not conscious. Again, same thing we do for surgery. And then after that, we do the euthanasia solution, which is what would actually stop their heart. Some people choose to step out before that happens. Some people want to stay for the whole thing. Again, either way, it doesn't matter to us. Everything's done the exact same whether you're here or not. So it changes nothing for us.
And after they get that anesthetic, they don't know if you're there or not.
Right.
I would say if it's something that you can handle, I personally feel like your pet is more comfortable when you're there.
Yeah, at least for the anesthesia, yeah.
Yeah, they know if you're not.
Yeah.
And not everyone, we talked about this yesterday, not everyone can be there, and that's fine. Everyone handles it differently.
Yep.
Some people can stay, some people, they can't see it, and that's fine. We understand that too. But your pet does notice if you're not there. So. Yeah,
and we, of course, if you can't stay for any of it, we love on them. We'll usually try to give them some snacks if they're still eating, and chocolate, ice cream, whatever we got around. But it's not the same.
Yeah,
it's not the same. So I mean, we can treat them as sweetly as we can, but it's not the same as their owner being there. So if at all possible, that is preferred, because sometimes they will look for you, and that's sad. That's really sad.
Don't cry.
So, so then, after we give the euthanasia solution, and I'll take a listen and make sure it sounds like their heart has stopped. There are some things to keep in mind that I don't think everybody thinks about or is aware of. They don't usually close their eyes. That is normal. That is 100% normal. Can be a little freaky, but it's normal. Other things that we'll sometimes see, as the energy is going out of the muscles, we may see some muscle spasms or twitching. That's normal as well. Sometimes they'll look like they're taking a breath. They are not. Their heart has stopped. but that can look a little scary to some people, and so it's something to keep in mind too. And so I typically will stay in here for another couple of minutes just to make sure there's nothing funky that happens that might scare anybody or that they have questions about. And then after that, we'll either step out and give you some time with them if that's something you want, or the client is welcome to leave at any point whenever they're ready.
Yeah, we do have a doorbell. So usually after we place the IV catheter, we will bring them back into you. If you want some more time with them before the doctor comes in, that's totally fine. We just tell you, ring the doorbell when you're ready and we'll come in.
Yep.
It's the same as after the whole process is over. If you want some time with them after they're gone, you definitely can. And we just tell you, ring the doorbell when you're ready. We'll come in and take over.
Yeah.
So.
Yeah. There's a few things that happen as options as well. So we will make a clay paw prints if that's something that you would like. Or sometimes we'll do like an inked stamped one, just depends. Those don't turn out as nice all the time.
No, they don't.
So it's not our preferred. We usually offer just the clay paw print, but if you wanted a stamped one, that's fine. We'll do the best we can. We just don't promise that it looks
they are
amazing.
very difficult to do.
Especially with hairy feet. Those are tricky. But yeah, that's an option. And then people can choose to have ashes returned to them or not. Most people have them cremated. Occasionally we get somebody that wants to bury their pet, and that depends on where you want to take them and stuff. I mean, I don't know all the rules with that, so you do you. I'm not going to tell you no. Whatever, but that's your responsibility to know what your rules are.
Yeah.
But yeah, most people have them cremated, and then
whether they get the
ashes back or not. It's all cremation. It's just a matter of if you want the ashes returned to you or not. And you can choose an urn, or they come in a little plastic urn box sort of thing. It's actually really nice.
It is.
So that's kind of the process. Is there anything else? Did I forget anything?
I don't think, sometimes they will defecate or urinate after they're gone.
Yeah.
So if you see, a potty pad or something under them, that's why. Especially if you're holding them. Because I know some places won't let you hold them.
Oh, that's weird.
Which is weird. Yeah, and that was a long time ago. I don't know for sure now, but we do. And usually you'll put like an extension set or like a long line on there, kind of like an IV line. Well, it is an IV line, but not like for fluids. So that, we can kind of be out of your way. So you're free to love on them if you have a big group of people.
You want to hold them here, you can hold them here as long as they have access to the leg.
Yeah.
That's
so you can have the whole family. You can have, we can be basically on the other end of the room if you wanted us to. You're scheduled for a visit in 2021 too.
Yeah, I thought so. I thought I was. See, Santa knows. But yeah, so there's a lot of different options. I've done ones where we've gone outside. That's a thing. We do house calls as well. That's an option. We need a little bit more time. Like that we can't do on a last minute basis typically. So if you called me up and said, we need to do it right now, come to my house, that's trickier just because that's a long time that we have to be away from the clinic, because we have to plan that out a little bit better. But it can be arranged. If we get a day or two notice, we can usually figure it out.
Yeah. Or like today, we're not super busy this evening so far. So it'd be something, it just depends on the day.
Yeah. Yeah, and what we had going on, if there's something we can reschedule or not, it just depends. Yeah. So, yeah, you can call and ask, but that's not always available last minute, so something to think about. No, there was something else I was going to say, now I forget what it is. I don't know. So we have a cremation service that comes to pick them up, called Loving Hearts. They do a really beautiful job. So.
They do. And they're fast.
They're good people. They're very fast, which I really appreciate. So when you're getting those ashes returned to you, truthfully, it's usually within a week or less. Depends on how busy they are. I think we usually tell people at least a couple of weeks, but It's usually
I know the
faster.
cremation service we used before, it was like 4 to 6 weeks,
Mm-hmm.
and then we would get them back.
Mhm.
But Loving Hearts, usually, like Dr. Hogan said, it's usually within a week.
Mm-hmm.
Like we
Yeah.
did one yesterday,
Mhm.
and they came today already.
Mhm.
So, I mean, the ashes weren't back today, but they came today, so.
Yeah. So, again, as we get into like busier season for that, I'm sure it'll start taking longer, but yeah, they do a really good
That's
job.
awful.
I
Awful
know,
to
it's
say.
really disappointing, but it's around the holidays that those things
Or
happen.
maybe, do you
but
think it's just because we notice it more? Because it's.
no, I think that they're real, and I think that this is industry wide. It's not just like, oh, I feel like this. Like
Yeah.
everyone sees it, where it's just that time of year, it's bad.
Especially around Christmas.
Yeah, like between like around Christmas, like a week before Christmas, and then like to New Year's. It's a bad couple weeks. It's depressing.
It is.
But yeah, I mean it's something where usually when they come in, we're like, yeah, it's time. It's time. So it is hard. It is hard for us. But
Yeah.
it's part of the job. It's okay. Because we get a lot of people that'll be like, oh, I don't know how you can do this. And it's like, well,
But I think
it's not an everyday thing.
Yeah.
It's not an all the time thing.
sometimes we go like a couple weeks
Oh yeah.
without.
Yeah.
And then sometimes it's. I remember.
multiple in a day.
Yeah, I remember. What was it? Last year, or the year before, we did like 6 or 7 in 1 week, and
I had one day where I did 5 in one day,
yeah,
and I think over half of them, the owners didn't stay, and that stunk. That was hard.
and everyone handles it differently.
Yeah.
And I mean, I know I said that already, but it really is true. Some people they just can't.
They just can't.
And I get it.
Yeah.
And
it's not because they don't care.
right.
It's not like take my animal. It's not like that. It's usually like they are so torn up they cannot stay.
Yeah.
But yeah.
And I mean, how do you feel about just like giving them something to get them nice and sleepy before the owner leaves?
Oh yeah.
Yeah.
We can even
So
do
that's
that.
an option
Yeah.
too.
Absolutely.
So.
For sure. So yeah, I think that's everything. Certainly, if anybody has any other questions or something that we didn't cover, something you've always wondered about with euthanasia, definitely let us know. And for sure too, if you have questions about your own animals, you're just debating, you're not sure. Maybe you're not even necessarily close to that time, but like
You wanna
your
be
animal's
prepared.
older and you want to be prepared. Great, let us know. And we can always send you, you can Google the quality of life scales that we've got, but we can always send them to you as well. And it's something you can look over and just, on a periodic basis, like every couple months. Like, hey, my animal's 47 years old. It might be time soon. And so, something to just consider every couple of months and kind of look at it and see what the trend is and go from there. So, sorry this was a depressing one, but we thought it was something that was important to, discuss and go over and kind of just explain a little bit more about what we do and how we do things and what to consider and what questions to ask. So,
Because everyone does it differently.
Mhm.
And there's a lot of different things to consider when it comes to that.
Yeah.
And kind of what you're looking for. So definitely, I hate to say it, but, people do price shop these things as well.
Mhm.
So I think it's definitely important to ask the places that you're calling what their protocol is and how they do things.
Mhm.
And just pick someone that you feel the most comfortable with.
Mhm. Yeah.
So.
Yeah. For sure. Yeah, because having done some relief at work recently over the summer, it's everybody has their own way of doing things, and I don't necessarily like how everyone does things.
And their protocols, and
it's all different. Yeah.
Some places aren't letting anyone stay right now.
Mhm.
Some places are letting one person stay.
Mhm.
So that's important to look at too, because I don't know that we went over it, but right now we are allowing the whole family to come for that.
Mhm.
Appointments, we're still just doing one person per family.
Yeah.
But for the euthanasia, we are allowing the whole family,
Mhm.
or friends of the family, whatever.
Whoever is wanting to be there.
Yeah, we're requiring a mask still, but
Yeah.
we do have a separate room,
Mm-hmm.
like we said, with an entrance and an exit. So it's not like we're having all the people coming through the lobby.
Mm-hmm.
And then we do disinfect the room after you're gone.
Yep.
So that's why we allow people in.
Mhm. Exactly.
So
Exactly. So yeah, so like I said, if there's something else we didn't cover, definitely let us know. This was a really long video.
it
Sorry.
was 45 minutes.
I didn't think we were gonna have that much to talk about, but that's okay.
Yeah.
Sometimes, something sounds like a short topic and it's not.
Well, it's important. It's a big deal.
It is.
It's not something that you should take lightly.
Yeah.
And we definitely here we don't take it lightly.
No.
So
We try to be very accommodating.
very
Yeah.
thorough. If there's anything else that we think we can do for your pet and you're willing to try it, we're definitely on board.
Yep.
So
Definitely. So, all right, everyone, have a good rest of your day, and we'll see you next week. Bye.
bye.